My heart was racing at 145 beats per minute, and I was setting down. My vision went blurry, and my entire body felt as if it were swaying like a porch swing in a windstorm. My chest felt like there was an elephant sitting on it. No, I wasn't having a heart attack. I was suffering from a PTSD related panic attack. I want to talk to you today and tell you about the effects that trauma has on your body. This topic is important to me because I, like many women, am a survivor of domestic violence. According to a 2004 article by Joel Clotter in the Townsend Letter, an estimated 2 to 4 million women are physically assaulted by their partners each year. I struggle with the effects of post traumatic stress disorder, or PTSD, daily. After mental trauma from domestic violence, survivors also become subject to physiological side effects. During traumatic events, the area in our brain known as the amygdala reacts by going into a state known as the fight or flight. As a reaction to this altered state of mind, our brains record the events as a memory in the area of our brain called the hippocampus. The 2006 article, Trauma, Get Over It, in the Utne Reader by Joseph Hart, clinical psychologist Andrea Northwood states that when people are in this state of hypoarousal, we encode memories very differently. The article continues on to discuss what are called flashbulb memories. This happens so the body can recall similar situations in the future, so we know how to react should it happen again. Although this is meant to be a natural defense mechanism, it can also be a devastating thing to a trauma survivor. These flashbacks often occur when not presented with a current threat, but rather an associated trigger related to the event. This causes the body to react in a similar manner to that which it did when the trauma occurred. Because the body may be in a heightened state of fight or flight more often than normal due to flashbacks, this can lead to the development of anxiety and depression. When the body is anxious, it not only affects your mind, but it also manifests through physical symptoms, such as a panic attack. The same can happen with depression. Intrusive thoughts and painful memories can bring a survivor into a dark period of depression. This can cause a loss of appetite, lack of hygiene, and pose a higher risk of suicide. Heightened senses of alertness due to anxiety often cause tension in the muscles. This can lead to muscle stiffness and pain. Another common condition is a tension headache. According to a June 2020 study by Mehmet Hamasi and Seyhan Dumlandog, published by the Journal of Turkish Sleep Medicine, patients with tension headaches were found to be at a higher risk for sleep disorders such as sleep apnea and restless leg syndrome. Because survivors often suffer with sleep disorders, they also suffer with chronic fatigue. The body feels constantly tired and lacks energy to complete tasks throughout the day. This can often worsen depression, placing the survivor in an infinite loop of self-destruction. To combat fatigue, survivors often attempt to self-medicate using drugs and alcohol. A survivor may turn to excessive use of caffeine to stay alert. Even worse, they could turn to a more harmful stimulant such as cocaine. On the contrast, the survivor may find that the euphoria from drugs such as alcohol and heroin can numb the pain of their traumatic past. In a June 1998 article published in the Maternal and Child Health Journal, researchers studied a group of 84 substance abuse treatment patients. Of the 84 participants, 42% had been victims of physical violence. Use of drugs such as cocaine and heroin can be dangerous with even short-term use and can cause a lethal overdose in as little as one use. Most people have experienced that feeling you get when you go through something negative and it feels as if your stomach did a somersault. This is caused by the release of cortisol during times of stress. Cortisol is a hormone that your body uses in the fight or flight response. Our bodies make changes to conserve energy during this fight or flight response in order to prepare for a fight. This includes slowing the digestion process. When the body starts this process, it attempts to empty the contents of the digestive system. This causes an instant feeling of nausea and the need to use the restroom. Because survivors of trauma experience this sensation so often, it causes long-term damage on their digestive system. This leads to conditions such as irritable bowel disease, ulcers, and erosion of the lining of the esophagus. Another side effect of the fight or flight response is elevated blood pressure and an elevated pulse. This is meant to be a temporary state, but with repeated exposure, it can lead to hypertension or chronic high blood pressure. This can lead to heart attack and even death. As you can see, trauma affects so much more than the mind. Trauma